Hi Cheyenne. So my name's Kia. I'm an OTA PTA student at Canada College. I work under Brenna, your occupational therapist. So as you know, you recently underwent a hip replacement yesterday, correct?
Yes.
And so because of that, there's some new rules that you have to follow, which I'm sure people have been telling you over and over again.
Yeah.
Some of those rules, as you know, are you can't really bend down, you can't shorten your hip muscles or anything like that. So you have to stay nice and wide and extended and keep your hips nice and open. You can't turn your ankles out to rotate your leg outwards or inwards. And you can't separate your legs or have them too close together. So you can't really cross your legs either, okay?
Okay.
So because of that, dressing and daily activities are going to look a little bit different for the next few weeks. Fortunately, science has come a long way and we've developed some really amazing tools to help us do that for you. So I'm going to show you some of these assistive devices that are going to help you with getting dressed. That's our focus for today, if that's okay with you.
That's fine.
Excellent, I'm glad to hear. So to start off, I noticed that you have these clothes for today. That's excellent. So we're going to be working with this. It's called a sock aid.
Okay.
So the purpose for this is to help you put on your socks without bending your hips and leaning forward, right? Because that would be breaking your rules that you have to follow.
Okay.
So in order to do that, you're gonna have your socks, and then when you sit down in your chair, just make sure that you have everything. So you're gonna take the sock, I'll set up this one and then we'll have you do the other one.
Okay.
You're gonna pull it all the way up so that your toes and stuff are covered. Just make sure that you don't have any slack or loose sock at the bottom, because then you're gonna have that floppy sock problem.
Okay.
And then you just pull the sock up and along the sock aid. It's easiest to make sure that it's not bunched here, because if not, you're gonna have a bunchy sock and it's gonna be the worst. So when you have the sock aid ready, what you're going to do is you're gonna flop it over your knee so that you line it up with your foot, and then lower it down so it touches the ground. That's how I recommend that you do it.
Okay.
And then you can slide your foot back, and then you'll be able to feel your toes touching it without having to move your foot left or right. And so then you just pull it up and you inch your foot in, and then you're gonna slowly pull it up and over your leg. I can instruct you and assist you through it. So
Alright.
what we're gonna do, the easiest way that I do it is I line it up around your knee like that,
Okay.
then lower it down and back up your foot. Perfect. And now do you feel that at your toes there, the sock aid?
Yeah.
Perfect. So now you're gonna extend your foot and pull the sock aid, yeah, and inch your toes up in there. That's great.
And then I pull it up.
Yep, and then you slowly pull it up. The slower you go, the more likely you are to have a good sock application.
Oh,
Perfect. That looks great. Ooh, that's just because of the spring at your sock, or the cinching at your sock there.
Alright.
And good. How does that feel? That looks like it fits you really well and everything.
It's good.
That's really good. And you did really well abiding by all of your precautions.
Thank you.
Of course. Like I said, I'll be sure to report all of that progress to the supervising occupational therapist. Okay, so Cheyenne, now I'm going to teach you how to apply pants. Obviously, because of your hip precautions and stuff, putting on pants is also hard. So we just went over the rules, but again, you have to make sure that you're not going to abduct or adduct your hip, which just means put it out too far or put it in too far, and then you can't turn the bone or anything like that. And
Okay.
once again, you can't close that gap in your hip there, close the space. So what we're gonna do now is we're gonna take our pants, we're gonna shake them out, and we're gonna drop them open on the floor
Okay.
in front of your affected leg. This is called a dressing stick. The hook that goes outwards is really good for grabbing and pulling up. The hook that goes downwards is really good for pushing and changing the direction.
Okay.
So what you can do if you want is you can slide your heel back underneath you more. Perfect. And then you can lift your leg a little bit, and then you can, here, let me help you. Perfect. And now put it back down. Great. You're just doing that so you can get your pants around, or your foot inside of your pants properly.
Alright.
So you're going to take the dressing stick, and you're going to point your toe on your leg, and you can extend it a little bit, and then you're going to reach with the dressing stick and hook it like that. Okay, so there's that. Perfect. That's so great. And then yeah, you're just going to give it a nice pull, and then when you can reach it, you can grab it up and pull it nice and up over your heels like that.
Alright.
That's perfect. So you can put that foot back down on the floor and just slide that heel back under you. It's just gonna help to tuck it in. Take the side of the hook that's pointing down, slide it along just like that. Perfect. And then you're gonna open up that and help to put your other leg in. That's excellent. And then you're just maintaining your hip rules. And then that's excellent. And you're gonna use, perfect, yep, you're gonna use the far side of the hook just like that. Ooh, let me help you a little bit there.
Thank you.
Of course. That's perfect. And you're gonna keep on pulling that all the way up.
Mm-hmm.
That's awesome. Perfect. And so then you're just gonna lean it somewhere so that you can reach it.
Okay.
What we have to do now is we have to stand up. So I'm gonna have you take your hips and scooch them all the way up to the front, just like that. That's perfect. So normally when we have someone stand up, we do nose over toes. We can't do that because you would break your hip rules. So instead, I'm gonna have you keep your pelvis nice and wide.
Okay.
You're gonna push up off of the handles, and I'm gonna help you, and we're gonna stand together and pull up your pants. Okay? So whenever you're ready, you can go ahead and push off. You can do it on the count of 3 if you'd like.
All right.
So 1, 2, 3. Push off. Perfect. That's awesome. And so it's just important to remember when you're standing up like that you keep your hips open and that you don't push your forward or the top part of your chest up before you stand.
All right.
Perfect. Okay. And so then you would just tie it and great. Sit back down. That's awesome. So you did really well with that, Cheyenne, and I will be sure to report all of that information to the occupational therapist as well.
Awesome. Thank you.
All right, Cheyenne, so now I'm going to teach you how to use a shoe horn. We've got you all set up here because we just started to go over it. So what you're going to do is you're going to grab your shoes, you're going to tie them and bring them to the area where you're going to sit down.
All right.
And then you are going to grab your shoe horn and just like that, and you're going to take the end of it and you're going to push it along the back of the shoe.
Okay.
So you can take your affected leg and you can kick it out in front of you.
All right.
And then I'll slide that over a little for you. It just depends on the positioning of the shoe. Now lower your leg back down and slide it until you can feel your heel up along the shoe horn.
Okay.
That's perfect. You can slide it a little bit more. You're not breaking your rules.
Okay.
And then put your toe into the bottom of the shoe. That's good. Perfect. And then you just push down and slide your toe in. That's perfect.
Awesome.
And how does that feel? That feels okay?
It's good.
Great. Okay, so now we're going to repeat that on the other side. So I'll let you try and do that pretty much independently.
So we move the shoe behind me?
Yeah, you can pull the shoe with the shoe horn. You can extend this leg if you want. Yeah, kick that out. Perfect. And then, yeah, that's perfect. And then you just wiggle your toes in there and push. Oh, that one. Oh, the shoe horn bent a little. That's okay.
God.
That actually happened in our lab last time too. I'm gonna leave the head in, I think. I'm just gonna help the patient finish that. And I'll show you this. But yeah,
I'm so sorry.
Cheyenne, you did super great, and I will inform the occupational therapist for all of the information. Thank you.